we're in a cloud. Okay, we are live, and looks like I'm just going to do just an add middle. Everyone looks fine here. Double check. All right, I'm going to add middle.
Good afternoon, everyone. We'll give people just a couple more minutes to come into the Zoom room. I'd like to welcome everyone on behalf of the School of Public Health. My name is Nevin Cohen, and I'm a faculty member in the Health Policy and Management Department of our school. And I'm also the director of the CUNY Urban Food Policy Institute, which is a research center here that conducts research and produces evidence for policy advocacy and action. Our mission is to create more just, healthy, and resilient urban food systems. And I'm really delighted that we have Dr. Sherry Barron and Emma Vignola here today to talk about an issue that is one of our core elements of research and action at the Institute. The Institute is focused on social justice in the food system, and a core element of that is social justice for food workers who represent in New York and other cities around the world a large and growing portion of the labor force in cities. And often it's a very poorly paid segment of the workforce with very poor working conditions. And the Institute has been doing research on this segment of the workforce pre-COVID, during COVID, and we're really interested in changes to the labor force that are happening and are about to really transform work in this sector and in other low-wage sectors in cities around the world. So what I'm going to do today is introduce Emma Vignola, who's been doing research on this topic with Sherry Barron. And then Emma will speak for a few minutes and then turn it over to our main speaker, Dr. Barron. But I'd like to introduce Emma. She's a PhD candidate in community health and at the CUNY School of Public Health, and is a doctoral fellow at the CUNY Urban Food Policy Institute, where she coordinates a number of food labor projects. She received a BA in behavioral neuroscience from Barnard College and a master's in international health from Johns Hopkins. She's worked in the US and internationally in child development research and in health workforce training, and her interests focus broadly on political determinants of health inequities, particularly work-related health inequities. And we're really delighted that she's been a fellow at the Institute for the past several years, and I'm looking forward to her dissertation and work after getting the doctorate, and I'm really excited that she's a part of the Institute. Our main speaker is Dr. Sherry Barron, who's a professor of urban studies at Queens College. She's an occupational physician and a professor at the Barry Commoner Center for Health and the Environment at CUNY's Queens College. She's an affiliate professor at the CUNY Graduate School of Public Health and Health Policy, so we're delighted that she's speaking today. Previously, she spent 25 years as a researcher at NIOSH, where she was the coordinator of the Occupational Health Equity Program. Her research focuses on employment as a social determinant of health, with a concentration on how employment quality combined with workplace exposures contributes to structural health inequities. Her current research includes Safe and Just Cleaners, an NIH-funded research to action project which applies a community-based participatory research approach for collecting data on Latinx household cleaners' chemical exposures and other working conditions in the metropolitan area of New York City. She's also the PI for a 6-country study of non-standard and precarious employment based at the Karolinska Institute in Sweden. And through that study, her team collected qualitative data about workers' experiences in non-standard employment in the New York City metropolitan area. And she's comparing their findings to data collected from workers in 5 other countries with different labor policies and social welfare systems, including Sweden, Belgium, Spain, Canada, and Chile. And Dr. Barron, Emma, and I, and other colleagues, including Nick Freudenberg, are working on developing a research proposal to combine research on precarious work and algorithmic management to focus on the conditions facing food delivery workers in New York City. And that's work that Emma has been very much involved in. So without further ado, I'd like to turn it over to Emma.
Thanks, Nevin, and good afternoon, everyone. As Nevin mentioned, my name is Emma. I'm a student at the school and a fellow with the Urban Food Policy Institute. And I was very kindly given this opportunity to give a short introduction to Sherry's talk, where I'm just going to give some context around why employment quality is of interest to our team at the Food Policy Institute. Sherry, would you be able to share your slides? Perfect. So awesome. Yeah, we can go on to the next slide, I think. So one of the Institute's focus areas, as Nevin mentioned, in our research and our advocacy is related to the well-being of workers along the food chain. So by food chain, we mean workers who are in the industries shown on this slide, who together make up a really large share of the workforce. There are many differences in terms of the specifics of occupations and industries along the food chain. But one thing, unfortunately, that food chain workers have in common is that many experience really poor employment conditions. So that means things like seasonal, part-time or contracted employment, very low wages, sometimes unpredictable pay, few or no rights to social protections like health insurance or paid sick leave. Unpredictable schedules is another big issue, limited opportunities for training or career advancement, and low unionization, pretty much across the board. And I would say that food processing sort of stands out here as offering better quality employment in terms of wages and benefits and access to unions. But the way that many of these workers were treated as disposable during the pandemic, resulting in really high infection rates and mortality from COVID, I think suggests there's a clear imbalance between the power of workers and employers, even in that industry. So let's hop on to the next slide, please. Thank you. So we know from past research that specific dimensions of these employment conditions have health implications. So these are just a few examples, but tipped wages have been linked with poor mental health among women service workers. Unpredictable work scheduling has been linked with psychological distress, poor sleep quality, and unhappiness among hourly workers in the retail and food service industry. Unsurprisingly, lack of paid sick leave among restaurant workers has caused sickness presenteeism, or when workers show up while they're sick, which is a problem for them, and it's also a problem for the public. But I think little research has looked at these issues together in sort of a holistic way. So next slide, please. So I think the concept of employment quality can help here. And the health implications of poor employment quality along the food chain is a specific topic that I've been able to explore in my dissertation and as a fellow with the Institute. So we'll hear much more about this from Sherry, but just to say now that employment quality is part of a growing body of research in public health that includes work among the many social determinants of health. It builds on traditional occupational health frameworks to include relational aspects of work, and it allows us to extend the idea of socioeconomic status, which we usually define in terms of sort of individual level income or education, to focus on employment relations and power dynamics between workers and employers that can be targeted for intervention and advocacy. So with that, I'll turn it over to Sherry.
Okay, thanks, Emma. So first of all, I'd like to really thank the people at the CUNY Urban Food Policy Institute for inviting me to speak. I've really enjoyed the collaborations we've had, and I hope that we can continue to work together on issues of food workers and health and safety and health equity. So before I start, I just felt like I really need to acknowledge what a horrible time we're facing in the world right now. And to a certain extent, I felt like maybe this talk should have been about war and public health. But so I thought I would just start with a slide that just acknowledges what an important issue this is. And I include an excerpt from my colleague, Barry Levy, who's a past president of APHA. It was a letter to the editor in the New York Times and talked about the horrors of war and public health. But moving on to the main topic for today of employment, I think the pandemic has highlighted many longstanding public health concerns. And one of these has been the importance of work as a structural determinant of health and health equity. It's really come into the forefront in people's consciousness. And I think beforehand, people had more recognition of healthcare workers and first responders and their role in these issues. But the pandemic has really put a focus on many other essential workers like food workers who for the first time were really recognized as essential workers. You know, unfortunately, like many other workers, even though they were recognized as essential, there's many studies now showing that the conditions that they faced within the workplace were very dangerous and many elevated levels of COVID. But whether an essential worker or not, in this period of the pandemic, many people have been reevaluating the role of work in their lives and their well-being. And what we've seen is over the last several months, the largest group of people voluntarily exiting the workforce. It's been called the Great Resignation. And so I think that's made individuals and society think more about, you know, what is going on with work in our lives and why are individuals so unhappy in their workplace. And so we know that work can lead to health, but it can also lead to ill health. And I have this kind of tug of war image here that myself and several colleagues have put together. And we describe it as a tug of war because one of the key components of health is that people feel productive. So work, when it's handled correctly, is one of the ways that people feel productive. They have job satisfaction, they have economic security, they have personal growth through their work. But I think more often, there's the pressures of work production that lead to job dissatisfaction, economic insecurity, hazardous exposures, and other kinds of work stressors. And so I think what we're seeing right now is that this concept of the pressures of work production and dissatisfaction are beginning to win in this tug of war process. So what I would like to do in this talk is talk a little bit about an approach to help facilitate public health researchers better incorporate the idea of work as a structural cause of health equity. And I'll be talking about that concept in general, but then also discussing some examples from my own research that Nevin mentioned at the introduction. And what I'd like to focus on is not only how we can identify issues in terms of employment quality and how it affects health, but more importantly, how this framework of employment quality can really be used to identify and inform interventions in order to improve health and health equity, and I'll include some examples from our work. So we know that the traditional way of looking at workplace safety and health is the hazards that exist in the workplace. So things like chemical, biological, ergonomic, cold, radiation. And these are super important. It's the bread and butter of occupational safety and health. Our colleagues at the School of Public Health who do this work are very involved in this, and I'm sure you've heard all about it. And of course, we know in food services, there's many workplace hazards that are very important to address. This is an image I use with my undergraduates to play, can you find all the hazards in the workplace? But we also need to think about the fact that individual workplaces where these hazards exist within a larger context of a national and international political economy and national and international laws that have a large effect on what goes on in these individual workplaces. And so this concept is what I'm going to be describing in terms of employment quality. So there's been a lot of discussion about changes in employment quality, and many people have been writing about this in both public health, but sociology, political science, et cetera. But I point to this one book that I think is particularly useful in thinking about how the workplace has been changing and how it might explain some of the dissatisfaction that people have experienced. So this book's called The Fischer Workplace. It's by David Weil. And what he describes is that what we've seen is through national and international competition and changes in political economy, that what both the private and public sector have done is to try and concentrate their profitability within the core functions within their corporation or institution, and have therefore contracted out many of the other services within their corporation. So that includes things like food services, janitorial services, sometimes even billing and human resources, shipping and receiving. And so by doing this, it allows them to really focus on the central profit margins, their core workers of production. But what that does instead is shift much of the risk of doing business onto these workers who are in contract work. And so what people have discussed is that we can think about workers in two groups. One is the standard workforce. And so that's workers who work in many of these core services within large manufacturing industries. And their jobs tend to be full-time. They provide decent wages and benefits, guaranteed leave. And for many of them, they're protected by a union contract. But then there's these other workers who have been called non-standard work arrangements. And so those tend to be workers who work part-time or irregular schedules. They have no explicit or implicit guarantee of long-term employment, often have poor wages and benefits, and most often are not protected by a union contract. And these workers go by a lot of different names: contract workers, temp workers, freelancers, gig workers, independent contractors, contingent. But with all those kinds of titles, we're talking about the same kind of phenomena for many of them. So this process has been going on over several decades now. And I show you this ad that was in a magazine aimed at the business community from 1971. I don't think that we would see such a crude way of advertising, but this is an ad for temp work that was called Kelly Girls. For those people who are closer to my age may recognize this, but these are temporary workers who worked in clerical services or secretarial services. So this was an ad selling their services where they said, never takes a vacation or holiday, never ask for a raise, never costs you a dime for slack time. When the workload drops, you drop her. And that was the whole sentiment around the growth of this concept of temporary workers. And so this graph, I think, illustrates this idea of the disposable workers pretty clearly. So you can see this is between 2000 and 2018. And the blue line is an index showing you the overall private worker workforce. And you can see that it stayed pretty constant over that time. And then the gray lines show you the periods of economic recession, and the red lines show you how employment changed within temporary help agencies. And so I think this plot makes it pretty clear that what happens is, as you have economic recession and retraction, what's happening is that these corporations are now maintaining their core workforce and laying off temporary workers and other kinds of contract workers. Another phenomenon, and this is particularly important in the food service industry, is the growth of gig workers, or they're often called platform workers. And I saw this research from the Pew Research and was surprised to see that in a recent survey, they found that 16% of Americans have ever earned money via an online gig platform. But what we've also seen is that the workers who increasingly are in these alternative work arrangements are disproportionately workers of color. So you can see here the change in employment in alternative or non-standard workplaces between 2005 and 2017 using some serial surveys that the BLS has done. And you can see that the increase is very dramatic amongst Black and Hispanic workers compared to white workers. And this is data from the same Pew Research Center study that I showed you. And you can see that the growth in gig workforce, the dark blue shows you gig workers overall, and the light blue are delivery workers who work for restaurants and other stores. So many in the food industry, which is very large in gig employment. And you can see that gig workers are disproportionately Black and Hispanic and lower income. So what we can see is this idea of low employment quality as the workplaces and economy is changing is disproportionately affecting workers of color, immigrant workers, low-wage workers, and also women workers. And so in this way, this is a form by which work becomes a driver of health inequity. So there's been various studies that have tried to tie the issue of worker health to temporary employment. And those studies have shown that insecurity is associated with mental health outcomes, that temporary work is associated with higher injury rates. And much of these increased injuries and illnesses people attribute to the fact that short-term workers may be more likely to be exposed to hazards in the workplace because they're unfamiliar with it. They may get less training, they may have less access to protections. So people have been very interested in this concept of employment quality and trying to better incorporate it into epidemiologic studies. But in the past, what's happened is that employment quality has been fairly crudely measured, so that there's questions like, how stable do you feel your job is? Or the BLS contingent worker survey asked, how likely do you feel you'll be in your job a year from now? And so that's a measure that gets at this idea of insecurity and being more temporary, but really doesn't capture all of the issues that are involved in employment quality. And so there's an international collaboration that's been working over the last decade or so in order to figure out how to measure employment quality in a more complete and more systematic way. So this is just a diagram that shows you how people have begun to conceptualize the idea of employment quality, to put it into research studies. And so they think about it as a multi-dimensional framework that has 7 main dimensions. So the first on top, you can see employment stability, which gets at these issues that people have been looking at in the past. But then they add to that the idea of material rewards or low earnings, whether or not workers have rights and protection like access to fair wages, leave policies, health insurance, discrimination, et cetera. Their work time arrangements, what are their hours of work like? Are they underemployed or do they have irregular work schedules? Whether or not they experience unbalanced interpersonal relations with their employers and supervisors. Do they have a collective organization like a union that can advocate for them? And does their job include training opportunities so that they can grow and develop in their job? So the idea of employment quality is to create this multi-dimensional framework that allows us to think about collecting data that more fully quantifies the concept of employment quality and how it might affect people's lives. And so the operationalization of this framework has taken various forms. It's an ongoing research endeavor that's evolving and I think is quite exciting in terms of what it can contribute. So there has been some very important work done developing indices using survey data in Spain that has been replicated in other countries. But there's an ongoing effort to try and make this more internationally comparable. The other approach that people have used is to use existing administrative databases and to pull items that map to the various dimensions of employment quality in order to develop typologies and to compare those different typologies of employment to look at things like mental health and self-reported health. And both cross-sectionally and longitudinally, they've been able to demonstrate associations between employment quality and health. So what are the pathways that people have proposed by which employment quality leads to poor health? So the first is, if you're in low employment quality, you have disproportionate exposure to workplace hazards. You also, part of this is you have low wages and decreased social protection. So that has a spillover in terms of other structural determinants of ill health, like food insecurity, housing insecurity, access to healthcare, et cetera. And then low employment quality may also reduce workers' ability to control their life and the circumstances of their lives. And this often is related to issues of time. As people are in these jobs, it's very difficult to get control over your life and the balance between your work life and other aspects of your life. So I think the use of employment quality framework in public health can take 2 forms. One is it's a research tool, and we can collect items in survey research in order to more clearly demonstrate work as a social determinant of health and how it contributes to health inequities. but also it's a way to more comprehensively identify intervention pathways where you can combine employment quality with trying to reduce hazardous exposures in order to improve the health of the workforce. So what I'm going to do now is introduce you to some of my research that addresses both these ways that employment quality can be incorporated into health. And so the first study I'm going to talk about is called Safe and Just Cleaners. It's a community-based participatory research project that is looking at improving safety and health for Latinx household cleaners in New York City. It's a NIH funded study that we're now in our 4th year of a 5-year study. So the goal of that study is to try and characterize household cleaners' exposure to toxic components of cleaning products and develop campaigns to reduce exposures. And the rationale behind this is that there's been many studies in the past that have demonstrated that the kinds of products that household cleaners use regularly are associated with asthma, decrements in pulmonary function, dermatitis, and other kinds of health problems. And so the goal of this study was to collect a lot of data from household cleaners with a focus on the Latinx immigrant community in New York City to better understand what kind of products they use, what kind of work practices, but also what their employment quality is like in order to develop interventions. So our research partners for this project are myself and my colleagues in Queens College. We're also collaborating with the Icahn Mount Sinai School of Medicine, and my co-PI there is Omero Harari. And then the community-based organization that we're working with is called Make the Road New York. It's an organization that probably many of you who are in New York City are very familiar with, but Make the Road New York is one of the largest community organizations in New York City. It's got a membership of about 24,000 members, and they organize around education, justice, policy innovations, and transformative education. And so we've been collaborating with them around issues of worker justice for about 7 or 8 years now. So the research questions for this study is, of course, to look at which cleaning products and work practices are most common and lead to exposures. And the study involves measuring those exposures quantitatively. But we're also interested in how cleaners' employment conditions might affect exposure levels and health, and what kind of actions by workers and community organizations could reduce those exposures. So this gets at the whole issue of the relationship between employment quality and hazardous exposures. So what I'll be doing is presenting to you those aspects of this study, although the study has many other components. So in order, as one of the first stages of the study, we wanted to collect survey data from domestic cleaners throughout New York City. And we were interested, of course, in what kind of products and practices they use, but also in their working conditions. And so we conducted 7 focus groups in the New York metropolitan area and collected a lot of information related to the various components of the employment quality framework that I mentioned to you. And through those, we developed this framework for thinking about exposure in amongst these workers. So the idea is that a worker is involved in their cleaning tasks, and those cleaning tasks lead to exposures to cleaning products. One of the markers of their exposure to these cleaning products are skin, respiratory, and other other irritant health effects that are work-related. And that's what leads to physical and mental health. And so the idea is that applying the multidimensional employment quality framework, we can think about these characteristics of work, both having a direct effect on physical and mental health, but also having an impact on the way cleaners do their work and therefore on their exposure levels. So a lot of the information that we collected from the workers through the focus groups really mapped pretty well to this employment quality multidimensional framework. And so we developed items and scales related to 5 of these 7 dimensions. And the reason why we only did 5 is that we knew from the focus groups that collective organization, essentially there was no collective organization for domestic cleaners. That would be a goal of our study, but we didn't think there needed to be more data collected related to that. And also training opportunities was also a big focus of our study, but we were well aware that there were not many training opportunities for cleaners at the moment. So we focused on these 5 levels of employment quality in order to collect additional data. And so we characterized specifically these 5 dimensions using 14 different measures. Some of them were single measures and some of them were scales that we developed. But you can see here things, employment stability were like, what was their employment arrangement? How long had they been working in cleaning? Material resources were, of course, what their earnings were like from house cleaning, but also how much financial insecurity did they feel because of the nature of their job. Workers' rights were things like discrimination, unfair wages, health insurance coverage, access to paid sick leave, the number of hours they worked and the number of clients. And then we heard from the workers in the focus groups that in terms of unbalanced interpersonal relations, really those revolved around issues of their relationship with their clients. So things like time pressures, control over their work, how supportive or abusive their clients were. And because these were all Latinx immigrant workers, issues of communication due to language. So as the first stage of this study, we implemented this survey. It was a survey that was done in person with cleaners in 4 boroughs of Manhattan, each borough except the Bronx. And also we collected data in Westchester in order to get an idea of what it's like in more suburban areas. So we did our recruitment for the survey through the members of the community-based organizations that we partnered with, but also through other community and institutional relationships, like through schools and consulates and other places that immigrants go. And then we also did just plain street outreach with flyers or approaching people in parks and at train stops, et cetera. So we screened a little over 900 workers and had eligibility requirements in terms of having worked at least 6 months as a house cleaner in the US and have worked within the last 2 months. So there were about 600 who were eligible, and 70% of those eligible cleaners came and participated in our survey. So it was an in-person survey done by native speakers of Spanish. It lasted about an hour. So on average, the cleaners we surveyed were 45 years old, all were immigrants, but interestingly, most of them had lived many years in the US. About a third were uncomfortable with English, and over 40% were the primary wage earners for their families. So I'm not going to present all the results, but really focus on the data we collected that characterized the employment quality for these workers. So in terms of employment stability, 64% had worked more than 5 years as a house cleaner. So many of them were really long-term house cleaners. And they worked in a number of different kinds of employment relationships, but most of them, the vast majority, 3/4 were either solo, self-employed, or worked together with another cleaner, and about 16% worked for a cleaning agency. They were all had very low earnings. Almost all made less than $1,500 a month. And not surprisingly, because of this, about 20% worried a lot about having enough clients in order to make the earnings they needed, or having insufficient earnings in order to cover their expenses. They worked on average 22 hours a week. So they were, mainly part-time workers and had 3 clients a week on average. So in terms of violations of workers' rights, almost none of them had access to sick leave, only 15%. But interestingly, almost half said that they couldn't take sick leave, either paid or unpaid, because they feared retaliation. And almost half said they were paid below the minimum wage or had experienced wage theft. About 1/3 of them had experiences of discrimination at work, and the most common were based on the language they spoke and their immigrant status. They also, not surprisingly, very few of them, almost half of them, didn't have access to health insurance coverage, which is substantially higher than New York City in general. And then finally, in terms of unbalanced interpersonal relationships, we characterize that using 4 dimensions. One was the idea of time pressures. So about 20% of them talked about feeling pressure to work quickly in order to satisfy their client, feeling like they couldn't follow safety and health precautions because they needed to work quickly to finish their work. They also had low control over their work in terms of deciding how to do their tasks, or having their clients demand that they use stronger products. About 18 to 30% of them experience various kinds of client abuse and unsupportive behavior. And close to 20% said they always or almost always had language-related communication problems. So not surprisingly, given the workforce, we anticipated that they would have fairly low employment quality. And you can see here the various kinds of dimensions, but also by using all these dimensions, you really get a very full picture of all the different ways that their employment quality is compromised. So the first thing we did in our analysis was to look directly at how these multiple dimensions of employment quality affected physical and mental health. And so we used a couple of different measures of physical and mental health. First, the Center for Epidemiologic Studies 10-item measure for depression, and 24% of the participants scored higher than the threshold to be considered depressed. We used the Cohen's Perceived Stress Scale, and 44% of the participants exceeded the threshold. And then we used the 5-item for fair or poor self-reported health, and 29% of participants fell in that category. So this shows you the multivariable logistic regression analysis, focusing just on the variables related to employment quality. And so I won't go into detail on each of the measures, but you can see that both for mental health and self-reported health, there were significant associations between one or another of the 5 dimensions of employment quality. and those health outcomes, confirming, what we suspected, that employment quality is associated both with mental and self-reported health. So the next part of our analysis, we were interested in, as I said before, that multidimensional employment quality might directly affect physical and mental health, but it also might affect physical and mental health by virtue of impacting the workers' exposure to cleaning products by the work practices that they used in their cleaning. And so we wanted to look at this form of mediation of the effects of employment quality so we used a marker for exposure to cleaning products, work-related skin, respiratory, and other irritant health effects. So in the second analysis, what we wanted to do was see, once we added these irritant health effects to our model, how did that change the impact of the employment quality on physical and mental health? So first of all, you can see this just shows you, not surprisingly, that the use of disinfectant products was very common amongst the cleaners. Over 50% of them reported to us that either in the bathroom or the kitchen, they used either a bleach containing or what's called a quat containing disinfectant products, both of which have been tied to these irritant symptoms. And what we found was that 27% of the cleaners had work exacerbated skin rash, which was 3 times higher than the exactly the same question for workers in general in a national survey. And 33% reported severe eye irritation, and 30% reported moderate eye irritation at work, and 16% reported work exacerbated asthma or nighttime shortness of breath. And so what we did was took the same model that I showed you before and added the work-related irritant symptoms to that model to see how it was associated with mental and self-reported health. And so what you can see here is that, again, not surprisingly, these work-related irritant symptoms were also very strongly associated with mental and physical health. And in the sort of thick red lines, you can see those measures of employment quality that were reduced down and actually, became no longer statistically significant. And the thin lines are the ones where it modified the point estimate, but they remained statistically significant. So you can see the main ways these impacts took place were through the dimensions of workers' rights and unbalanced interpersonal relations. So, the way I would interpret this is that, those kinds of things like workers' rights abuses and poor interpersonal relations with clients are the kinds of things that might impact the way the cleaners go about doing their cleaning tasks, and therefore that results in higher exposures, higher irritant problems, and physical and mental health problems. So what we were able to show is that both of these pathways, both directly and mediated through exposures in the workplace, employment quality had an impact on physical and mental health. So if we go back to the 3 pathways that we talked about originally of how employment quality could lead to poor health, I think we found evidence for all of those. So of course, we showed that both chemical and psychosocial factors in the workplace led to mental health and self-reported health. But also we found low earnings and financial insecurity was associated with health. And we can see clearly how those would be related to issues like their ability to buy good quality food and to live in good housing. And then our finding of time demands, I think, speaks to this idea of workers having less control over the circumstances of their lives in general as they try and balance their work, their home, not having enough income, and other kinds of factors. So now I'd like to talk a little bit about this idea of how you can then use what you learned from applying the employment quality framework to actually building campaigns. And so our community partner is a very active social justice organization and was very eager to immediately get cleaners involved in fighting for better rights as we did our study. So as soon as a cleaner was included in our study, they were invited to participate in our what we called the super cleaners group. So this was a group of cleaners that met on a regular basis who had been participants in our study and were involved in all sorts of training activities and campaigns that I'll tell you about. And we completed the survey. We did our last interview about 2 weeks before the pandemic began. So the super cleaners groups first met in person, but then they've continued to meet on a regular basis, on a monthly basis by Zoom. And we generally have, somewhere between 40 and 60 cleaners who participate in these meetings regularly. And so what have they done? So as we talked about at the beginning, educational activities and development is a key part of employment quality. And that was a big focus for our campaign to begin with. And so the super cleaners group learned a lot about the hazards of cleaning products. And they developed educational videos that they did themselves via Zoom and were distributed through social media and other ways, and focused a lot, because this was right before the pandemic, on how to clean safely during the pandemic. We also had done a Train the Trainer program with the National Domestic Workers Alliance and Make the Road New York, and developed a curriculum where cleaners themselves were trained to be cleaners. And the Train the Trainer was again done right before the pandemic, but then these 15 or so trainers actually implemented the training curriculum during the pandemic by Zoom and trained about 300 cleaners throughout the New York metropolitan area. So the results of our survey, we put it together in a kind of data brief, which was used by Make the Road in order to advocate for policy changes that were demonstrated through the data that we collected. And so this was a demonstration that they were held outside a church during the pandemic, where we did a release of this report. But some of the kinds of campaigns that they were involved in, and one, were directly related to the kinds of employment quality things we found. So things like they were very involved in the Fund for Excluded Workers campaign that appropriated over $2 billion in economic support for undocumented immigrants as part of the pandemic. And several of our cleaners that we've helped apply for this received the funding, and it was up to $13,000 per worker, so quite substantial. There was also the Cancel the Rent campaign to address issues of housing insecurity. And then we've continued to deal with the issue of lack of health coverage. And so they've been very involved in a healthcare for all campaign, coverage for all campaign that's currently in the state Senate right now. And I think it's passed the Senate and will be going in front of the Assembly, and hopefully will pass in this round. So the issues that we identified and the data that we collected related to employment quality have been really influential in the campaigns that have developed. So that's the first study. So now I'm going to shift gears and talk about a very different kind of study, which gives us a little bit of a different view or insight into employment quality and non-standard employment. This is a multi-country qualitative study. So this is qualitative data instead of quantitative data. And it's also involves 6 countries. So the idea of this was to explore non-standard employment arrangements and health across these very different kinds of countries. So the countries that were included are Belgium, Chile, Spain, Canada, Sweden, and the US. And just want to acknowledge there my collaborators as part of the US team. So these 6 countries can be described in lots of different ways, but this chart on the horizontal axis is a measure of labor market regulation. And on the vertical axis is a measure of the national social expenditure that goes into safety net programs, so that we can look at these 6 countries in terms of how much labor market regulation there is and how much of a safety net. So the US, you can see there, not surprisingly, is the lowest in terms of labor market regulations compared to all these other countries, and is about in the middle, more or less, in terms of social expenditures, with the European countries being much more generous. And so for this study, what we were interested is gathering information related to employment quality and health across these different countries. And so we recruited the participants for this study using social media, because this also took place during the pandemic. And so we used social media to launch a short survey that people would ask in order to recruit a very diverse population in terms of age, gender, and their employment quality. So the participants in this study included a full range of people from lower to higher employment quality to get a better breadth of the experiences. So they were all non-standard workers, but in a variety of different kinds of work arrangements. So you can see some of the workers, the non-standard workers with better employment quality were things like people who were working as consultants for the government, or a longer term adjunct instructor who was, feeling a little more secure in her ability to get classes. And then at the lower end of employment security, we had self-employed workers who tend to have more lower levels of security, and then also workers like cleaning workers, like we heard before. And so this, again, was a qualitative study where all 6 of the countries used the same interview guide and the same kinds of interviews. They were done by Zoom. They lasted about an hour, and the kinds of topics we were looking at were: why did people undertake non-standard employment? What was their employment quality like? How did it influence their health and mental well-being? How did they cope with these things? And what were some of the policies they thought might support them better? So I'm going to quickly just present for you some of the results from our US study. So we're just now in the stages of doing the comparison. So I'll focus really on what we found among US non-standard workers across this spectrum of levels of insecurity. So what we found was that there was one theme that emerged as consistent across almost all of the workers that we talked to. And we called this the hustle. It was the term we used. One person actually used that name, but we thought the hustle really captured the idea of the psychological pressure to survive on one's own and to constantly search for new and better ways to find enough work that was at a decent pay and reasonable work hours, despite having few actual labor rights. And so this was a theme that we heard from people across a variety of very different kinds of jobs, but all in non-standard arrangements. And so the concept of the hustle was affected by what we called both payoffs and trade-offs that have to do with how they make decisions about how they choose jobs. And that is not surprisingly related to a worker's social position and what kind of resources they had available to them, but also the low expectations that these workers had for their rights as workers. So I'll go over that in some of these themes in a little more detail. So the major payoff of non-standard work we found was flexibility. And this is, of course, what we hear from everyone, that gig work and all these other kinds of jobs give people lots of flexibility, and that's great for them because they can make their jobs fit better around their lives. And so we definitely heard this from people. Here's a quote from one worker. "It was great because of the flexibility. I went on a lot of field trips with my kids, and I was able to, without fear of taking time off from my job. It was just taking the nighttime shifts." And we also found that payoffs of flexibility were particularly important for certain kinds of workers who worked in things like the performing arts. And that was because they recognized that fact that either performing arts jobs are insecure by definition, at least in the US, although we found this in other countries also. But that also, in order to pursue their passion of the arts, many people worked in non-standard jobs in order to pay their rent and have enough money for food. And for some people, for a very small minority, the flexibility was actually a way of escaping a toxic work environment from their standard job. So here's a quote. "When I quit the previous job, it wasn't just because of a move. I had a supervisor. She created a toxic environment, and I kind of said I would never work in an environment like that again. It's about having control of how I spend my day and who I spend my time with." So, we definitely did hear from people about the advantages of the flexibility of non-standard employment, but we also heard a lot of the trade-offs. So for instance, flexibility can lead to overwork because the more flexible your jobs are, the more of them you can do and the more hours you feel obligated to work in order to make money. So here's one quote. "I slept in the ATM. Why? Because my workload is 22 or 23 hours daily, so I could get ahead. I don't have time to take a break or go to the bathroom because I love my family. Sometimes my only option is to sleep in the train as I commute to work, to another job, or my boss asked me if I could do another shift because my financial situation, my workload, my family, I have to accept that job. I can't stop." Another trade-off we saw is, we've talked a lot about the insecurity of these kinds of non-standard employment arrangements. And that came across very clearly that instability leads to insecurity and stress. So here's a quote. "Because the work is more precarious, if someone is not content with the job that they're doing, they can just drop you. So I have to be a lot more on top of what I'm doing and push through my own issues in order to turn in the work." We also heard the trade-off of insecurity eroding workers' rights, such as sick leave, which we also found with our cleaning workers that they were afraid to take sick leave. So here's a quote related to that. I guess part of that has to do with the fact that I'm not in a standard employment situation. So I feel like I have to show up as much as I can. I don't want to put myself at risk of losing these clients. I don't really have anything tying us together except my work ethic, and the quality of my work. And we also heard a lot about this idea of unbalanced interpersonal relationships with their employers, leading to stress and health issues. So here's a quote from that. My supervisor and I worked pretty well together, but when he cut my hours from 20 back to 12, he admitted that he had been the head, had he been the head of the department at the time I was hired, my position never would have been created. I know the reason he cut me. And so we heard about health effects related to the hustle, and that was mainly related to issues of stress and exhaustion and emotional and mental health due to people working long work hours, having little sleep, their income insecurity. But it was kind of cyclical because even though they felt emotionally exhausted from this, they also felt that having good health and keeping up the idea of good health was important for them in order to keep up the hustle. So the more they tried to keep up the hustle, the more emotional and mental ill health they experienced. And then the final finding that we found was that in the United States, despite the fact of all these issues related to employment quality, workers had almost no expectation of even the most basic worker protection in the United States. So they framed it as normal for what it means to be a non-standard worker, or even normal for what it means to be employed in the US. And they had very low expectations of any kind of broader support from the state through any kinds of programs like unemployment or training or anything else. And when we mentioned things like universal basic income, which was something talked about more commonly in the European countries, people would say that's just like, that's just philosophical or pie in the sky or out of reach. That sounds good, but that's never going to happen here. Okay, so that brings me to the end of describing how the two studies that I've been involved in recently have been very useful in using this employment quality framework to think about how work affects health and health equity. And I think what we learned from this is that considering hazardous exposures is super important when looking at work and health, but it's also important to think about employment conditions and how those two things interact with one another. And the employment quality framework, I think, provides an approach that researchers can use to think about very specific kinds of questions they can include in their data collection when doing studies, whether specifically related to work or health and well-being in general. And then I think really importantly is the idea that employment quality and collecting information about employment quality gives us the data that allows us to advocate for interventions that would improve workers' rights and employment conditions in the workplace. And that's how we're going to make things better for these workers. So I'm going to stop sharing my screen now. And
thank you so much. We have a few questions, and I hear an echo, so I'm sorry if that's audible to everyone else. I want to thank you very much for the presentation. It's really eye-opening, and I'd like to forward a couple of questions from the audience, and then maybe we could have a back and forth discussion. I'd like to also say that other folks in the audience can add questions if you'd like. One question from Ameo Mari is very specific to your research. Many of the participants in the cleaner study were women of reproductive age. Did they discuss concerns about their exposure to those occupational hazards and their reproductive health specifically? And is reproductive health something that the group considered exploring in the research?
Yeah, so that's a very good question. Reproductive issues, whenever you're doing a study of women of reproductive age working with chemicals, my experience is it's always something that gets raised. So yes, it was an issue raised by workers. There's some preliminary studies looking at the reproductive effects of cleaning chemicals, and that's an area certainly of future interest. The focus of ours was really on the irritant effects and its effects on respiratory and skin related problems. And those are the products that we're focusing our quantitative measurements on. So it's a very good question. It's a very important topic in the whole area of consumer products, and certainly something that's going to be of importance in future research.
Thank you. We have a question from Shura White, and I'm paraphrasing these questions, but I hope I get the gist of it right. There's been an increased conversation about employee well-being during the pandemic, and our institute's been doing work on specifically looking at the food workforce during the pandemic. In the next round of data collection for your research, has there been discussion about how the pandemic has specifically impacted employment quality for individuals who work as cleaners, and I would add for other precarious forms of employment? And
Yes.
the second part of this, I'll
Okay.
ask both together, and you can answer them as you see fit. But as it pertains to workers' rights, is it even possible to talk about employee health without discussing the pressures of our economic system overall?
So I'll do the second one first, because that's an easy one. I mean, I think the pressures of our economic system is what's causing non-standard work. So it's intimately related to one another. So, capitalism drives all of this. And unless we deal with that as a root cause, we're not going to really solve the problem. But that's a bigger, more philosophical issue. In terms of COVID, so we actually were fortunate enough to get a supplemental grant from NIH to study COVID. And we did a follow-up survey with our cleaners and actually reached 3/4 of the cleaners to do a follow-up survey during, it was done between March and June of 2021. And so we collected a lot of data about the impacts of COVID, remarkably at that point. So this is like a year ago, over 50% of the cleaners had COVID. And then we also collected a lot of data about what their working conditions were like. Many of them had, of course, lost work. Many of them suffered from food insecurity and housing insecurity. And, not surprisingly, because of all the emphasis on disinfectant use, we found that the use of these products actually went up, both in their workplace and in their home. In terms of the second study, we collected these interviews last summer, so it was during COVID. And so we actually included COVID as part of the interview questions. And interestingly, we felt that COVID was definitely an issue, but that for non-standard workers, the way it affected them was really not that different than a way it affected workers in general. So for some of them, actually, they got to stay at home and their life was easier. And for others who had to work outside of their house, it was more challenging. And, for actually a small percentage, they had actually become non-standard because of COVID, but that was not really the majority of workers. So yes, that's actually something that comparative analysis is going to be looking at, is how COVID impacted this across the different countries.
It seems like isolation is one variable that's very important, isolation of workers to each other. And I wonder if you could comment on, perhaps from your second study, the role of worker isolation as a factor in exacerbating health disparities, and also whether you have any experience with worker organizations that might not be traditional unions, but might enable workers to talk with each other and share information.
Yeah, great question. So I think isolation is a huge issue. So even if people are in non-standard work in a group setting, so they have coworkers, part of the idea of non-standard work is that you tend to be more temporary. So I think the idea of feeling isolated is going to be a problem, because, if you're a temp worker, you come into a workplace and, everyone else works there full time. And so you're isolated in that sense. And, the idea of constantly having to be in a new workplace or a new situation always means that you feel like you're an isolated worker, even when you're working around other workers. And I forgot the second half.
Oh,
of
it
the
was
question.
about worker organizations.
Oh, yeah, worker
freelancer
organizations.
unions.
Yes, that's a great question. So, there's a number of organizations, not just Make the Road New York, but a whole network of organizations that are called worker centers, and we work very closely with those worker centers. And so they're not unions, but particularly for immigrant communities, they tend to be community-based organizations that organize specifically around the issues of workers' rights and help them with training around worker safety and health, but also with things like wage theft and other kinds of issues. And the National Domestic Workers Alliance is, it's not quite a workers center, but similarly a non-union association that has been very actively advocating for workers. So that's super important for these workers. I know a lot of us at CUNY are in a union and know the importance of unions. And of course, worker centers are important, but they don't have collective bargaining rights. And so having unions that actually have collective bargaining rights is an important thing for the future in terms of organizing these workers and advocating for them.
Great, thanks. And we have a related question. The question is, it seems like workers had little expectation from the government or their employers to provide social protections or improve working conditions. And how much do workers have a structural understanding of their employment quality and their health and well-being and their power or lack of power to control working conditions?
Yeah, so I think, the reality is in the US, most workers have really very little control. So, those people in unions, those of us who are professors, we have contracts and we have some predictability, but for most workers, even if they think they're in a sort of stable position, they can be fired at any point. I mean, they get unemployment benefits, but, none of us, most workers have no job security in the US, which is really different from many other countries where there's many more protections for workers. So, we found that workers are acutely aware of that. And, and the, I guess, sad thing is that they're acutely aware of that and they feel like there's nothing they can do about it, and that they have no expectation that there's a solution, and that, that leads to this idea of the hustle, because they feel therefore it all falls back on them to solve their problems.
This is a question that relates to researchers and their political position with respect to the research. Does a focus on employment quality serve as a way for public health researchers to become more connected with the labor movement and other political movements? From your experience, either with these projects or in your career as a whole?
Yeah, no, I would say, I mean, I spent, 25 years working at the part of CDC that does worker safety and health. And so there, everyone had chosen worker safety and health as a career. But, one of my interests in coming to work at CUNY was the idea of interacting with people who are in the field of community health, health policy, to really try and build public health programs that considered work as an important part of the overall health of individuals. And so I think that's been one of the great things about starting to collaborate with the Urban Food Policy Institute and with other people. I saw Emma Tsui's there, and we've done collaborations. And so I think there's a lot of possibility to address some of the other kinds of community health, public health problems by using this entree of work, because, people spend a lot of time at work. They think about it a lot. It's an important part of their identity, and it fills a lot of their time. And so trying to engage people in the issues of their health through talking about their work and their work situation. Myself and my colleagues, I see Isabel on her picture there, who I work with, who's worked with me on all of these. That's what we've been trying to convince people to do. So, I hope in the future we can build some more collaborations with others in the School of Public Health around these issues. And I think the idea of the employment quality is, my experience has been, everyone understands the importance of hazardous exposures and chemical or biological exposures, but a lot of public health researchers just feel like that's out of their reach in terms of their skill set to do those kinds of measurements. And whereas employment quality is, gets at questions and issues that I think are within the toolbox of everyone in public health.
A question about the work that we are beginning to think through and develop, and that's a question of platform-based work and the use of algorithms to manage people. Do you have any thoughts on whether that sort of takes extends the space between workers and managers? And does that have an effect on both the quality of people's day-to-day work lives and their ability to sort of have agency within the workplace?
Yeah, so, this is a super interesting area, and hopefully we'll be able to continue to explore this. So for a lot of workers, particularly those who work on platform like gig jobs, but also in many other things like in warehousing and other jobs, it's now computer algorithms that basically give people their tasks. And so there is no supervisor that people deal with. They're dealing with this platform. And so it's a super interesting way of thinking about what does work stress mean when your main thing that you're interacting with and is determining what your work pace is a computer as opposed to a person. So yeah, I think there's a lot of issues to explore there, and is a totally new area of research.
Thank you. We have one quick question, and then we'll have to wrap up. But it's a question about worker cooperatives and whether there are any in your samples, or whether you have experience about cooperative management structures being different for worker health and well-being.
Yeah, no, worker cooperatives, I mean, obviously that's, one way of workers being able to improve their employment quality. In our study, we had, there was about 15 or 20 workers who worked in domestic worker co-ops, because domestic work is one of the areas where there's been a lot of co-ops developed. I think it's a super interesting area. The challenge is that it's really hard at the moment to make cooperatives scalable to a large number of workers. There's also a cooperative that recently got going for, Uber type drivers. And so they have their own app. I don't remember the name of it, but you can actually download the app. But, it's very challenging because these cooperatives have to compete in a market that is very difficult for a cooperative to compete in. And I think cooperatives like house cleaners and others, have been successful because there are a group of clients who are interested in paying their workers well and treating them well. And so hiring from a cooperative is something that's appealing to them. But I think the challenge is currently in the US, it's very difficult to scale up these kinds of jobs in a cooperative. It's very difficult to get bank loans. My son, has a carpentry shop, a small business, looked into seeing if he could become a cooperative. And basically he was told, like, there's no way a business like yours would ever be able to get a bank loan or anything else in order to operate. So it's very structurally difficult to do that.
Thanks. And I said that was the last question, but we did have a question come in as you were speaking, which I do want to pose to you. This could take another hour and a half to discuss, but maybe if you could briefly address on a global scale, what are your thoughts about migration, since many of the workers that you study are immigrants and in low wage jobs because of their status. And this is obviously an issue that will grow in significance.
Yeah, no, I mean, again, like the whole idea of employment quality is connected to large national and international forces, which includes all the forces that drive immigration and migration. So, we're seeing this in the US, but it's also true in Europe that, migrant workers, immigrant workers tend to be way disproportionately employed in the jobs that are the lowest employment quality. And their, immigrant status on top of everything else just compounds all the things that I talked about. So, yeah.
New York City has taken steps to address some work issues in the food industry for gig workers, for delivery workers specifically. So I hope that we do get a chance to collaborate on some new research focusing specifically on the food industry in New York. But I want to thank you again. Zoom is not a great place for expressing our thanks, but if you'd like to show the emoji clapping, we'd like to give you all a round of applause for this talk, and look forward to collaborating with you in the future, and are thankful that you're part of the school as well as part of the broader CUNY community.
Great.
Thanks
Well,
to all
thanks a
who
lot.
attended.
Yeah, it was great. Great discussion, great questions. And I look forward to continuing the discussions with people, hopefully very soon in person, as opposed to by this terrible virtual platform.
Thanks, everyone, and have a great rest of the afternoon.
Okay.